What are the benefits to the patient under the prospective payment model?
Oh, tremendous, tremendous. If you think about who the stakeholders are, there's the patients that receive the care, there's the physicians and their team who provide the care, and then there's whoever pays for the care. And ultimately, in America, we all pay for it one way or the other, as a taxpayer, or as an employee, or as an individual. So there's those three stakeholders: the payer, the purchaser, and then the provider and the patient. And so in the patient advocacy standpoint with prospective payment, first off, it's a reorientation to, I only worry about my healthcare or go get my healthcare covered when it's bad enough that I'll go have to pay some dollars to do that. And we all have different socioeconomic statuses, and so that's why you see these disparities that happen the lower you go on the socioeconomic curve, because people are delaying care because of the way we reactively have to pay for it. In a prospective payment model, it's more like a subscription. Everyone has a cell phone, everyone has a Netflix account, right? And so you use however you need be. And if you can align the incentives right, when the financial burdens are spread across and not hit you every time you're sick, in the worst moment, you can start to think about your health differently. In COVID, we're finding that people who are unhealthy or overweight are getting disproportionately affected by this disease. So there's a heightened sense now of, I need to care about my health in a different way. A prospective payment model would allow me to have the incentives to do that continuously. And it would allow me to do it in any modality I'd like. Is that email? Is that text? Is that video? Is that going into the office? It could be any of those depending on the circumstances. You could choose the right context depending on the content of the day of your health. You can use any location as well. You don't necessarily have to be tied to the physician's office for sure. I already mentioned the cost layer is more predictive for them. Right now, we hear about surprise billings all the time. Your primary care should have no barriers to you to get good primary care. The way we actually get to a better cost structure in America is to invest upstream in primary care, have the alignment happen with the care delivery model and the prospective payment, so that patients and physicians alike and their teams will want to work together to lower downstream costs by creating better health on the front end.